I'm Kitty Lamprecht and I'm your physiotherapist. This is an interesting way to meet. Next time we see each other, I will be wearing a mask, and this way you can at least see what I look like. This is just before your operation, which is called an Olif, which means or really stands for oblique lateral interbody fusion. Now that sounds a lot. But oblique just means the way that they approach the back. You can get B-lif or an A-lif, which is the same thing. It's just the B stands for posterior, which means from the back, and the A stands for anterior, which means from the front. So oblique just means that they are coming slightly from the side to reach the vertebrae. I think before we start, we need to just understand how the movement in the back takes place. Now, the movement in the back takes place over two columns. So your front column, which is over the intervertebral disc. Now, the intervertebral disc is like a shock absorber. It's got an outer rim and then a soft center. The soft center is quite important because not only does it help to absorb shock, but movement takes place over it, but also the soft center feeds the cartilage of the vertebrae. In time, or over time in the activities that we do, we push up the pressure of the intervertebral disc and it deteriorates. It becomes more bone-like, which means that the cartilage is not fed, and that allows the cartilage of the vertebrae to deteriorate. At the back, at the posterior column, we've got the facet joints. The facet joints lead movement, but also restrict movement. It prevents the vertebrae one from slipping over the other one, and therefore becomes unstable. So your Olif is about fusing both columns, and that's quite important to understand. So they approach it diagonally, and then the first thing that they're going to do is they are going to remove the disc, and then that will be replaced by a spacer that is filled with bone. And over time, the bone will grow and the two vertebrae bodies will fuse. So that's the front column. From the back, they are going to put little screws in the facet joints and pack that with bone, and that will also then fuse in time. So you will literally have a double column fusion, if we can put it that way. Don't worry too much about it, because when I do your home program, I'll give you pictures and I will explain it again. What is important is that first we understand that the fusion is going to be formed over time. So to help that, there are certain things that we need to do. We need to limit rotation or bending in the back, and therefore to help you, we are going to teach you how to move, but also you are going to wear a brace for the next 8 weeks. Secondly, what is important is that we need to try and protect the disc just above the level of your fusion, because if that goes, then the fusion needs to be extended. So we are limiting sitting because unfortunately, no matter how proper we sit with what good posture, the pressure in the disc is always high when you sit. So that is limited. It's not nothing, but it is limited. So, but what is important to me is that you also know what happens just after. So after your operation, when you wake up, you will be lying on your back. That is important for the first 4 hours. It helps to give compression on the wound, so it minimizes bruising, and that will help with the healing. In some cases, you might have a pump, a little pump that you can press for painkillers. Pain management is quite important. So it is important that if you have pain, that you will tell the nursing staff. Usually there's quite a lot of proper pain medication prescribed, and we want you to manage the pain, or we want the pain to be managed well. So please remember to notify the staff if you have pain. Secondly, is that around your calves you will feel that something pumps up, give a little bit compression, and then releases. It is important that that is happening. So if you don't feel that, also notify the staff, because it should. It helps with the circulation and it helps prevent clotting. Thirdly, really, it is important to realize that you can move your legs. Although there are these things around your calves, you can move your legs. After this, I'm sending you 2 other videos. The one will demonstrate how you can move just after the operation, and the third video will show you the exercises that we are going to do in hospital. You can try them on your own, so long then you know at least what to expect, but if you don't worry about it. I'm going to in any way teach them to you gradually as you progress. The second day after the operation, we'll get up. I'll teach you how to put your brace on, and that is when we start mobilizing. After that, things really go much better. You'll find it easier, and you'll find the stiffness better. A few other things. It is important that you bring something that is tight-fitting to wear under your brace. The brace cannot go directly on the skin. It irritates it. So bring something tight-fitting that you can wear. It is important that just before you start your fasting, that you would eat something. It helps to stabilize your blood sugar. Then I'm looking forward to meet you after your operation. I hope you have a peaceful rest beforehand, and see you soon.